And now, we bring you the following live press announcement from D.C. Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good morning. I'm Muriel Bowser. I'm the Mayor of Washington, D.C. I am joined today by members of my cabinet to provide a situational update. And before we begin, I just want to say a heartfelt thank you on my behalf and on behalf of my family for all the warm wishes that we have received from around the city. So thank you for that. Dr. Nesbitt, Director Rodriguez, and Chief Technology Officer Lindsay Parker will join me for the presentation and be available for questions. Let me look now at the chart that we provide daily on coronavirus.dc.gov to help you follow the district's progress with our fight against COVID-19. You are aware that we look at 4 buckets of information that help us measure the level of community spread, our health system's capacity, our public health system capacity, and the level of engagement we have with community members around all interventions. You will note, I think there was a day last week where the red metric, which is the daily case rate that is averaged every 7 days, has also, it was green for I think 1 day last week, and it is slightly above the green level. We continue, of course, to monitor it and look, as we saw for a week or so across the country, those cases come down, and we continue to be in the red as we monitor that level. We are very pleased that we now have 3 approved, safe, and effective vaccines that are being distributed in the United States. Moderna and Pfizer, of course, are now joined by the Johnson & Johnson vaccine. All of the available vaccines have been proven effective at preventing serious illness, hospitalization, and death from COVID-19. So Washingtonians are encouraged, as has always been the case, to get the first vaccine that's available to you when it's your turn. Yesterday, we announced that this will be the last week that we use the current system to book appointments. And DC Health and the Office of the Chief Technology Officer have been working with our vendor, Microsoft, to ensure a better user experience this week. Today, we opened our vaccination portal with 5,750 appointments. And the priority the priority zip codes could log in. People who are 65 or older, or between the ages of 18 and 64 with qualifying medical conditions. Tomorrow, on Friday at 9 a.m., another 5,700 appointments will be open also to DC residents 65 years or older and DC residents 18 to 64 with qualifying medical conditions, and all zip codes can log in. I've gotten a report from the team that today's access to the portal was smoother with increased server availability. A waiting room was added that allowed 3,000 users to access the appointment questionnaire at that time. And other technical things were removed or made better so that users could access appointments easier. So I am pleased with that. I want to thank our team at Octo, Lindsay Parker and her team, as well as Dr. Nesbitt and her team, and the vendor who was able to perform. A new path forward for vaccination appointments as well, and we'll spend a little bit more time talking about that. You've heard Dr. Nesbitt in previous weeks talk about what a different system would mean for how DC residents could register for the vaccine. and we're going to talk some about that this morning. This, of course, also comes at a time where we are getting more vaccine, which we know is going to be better for everyone who is demanding vaccine, who's ready for vaccine, is taking vaccine, that we will have more doses and appointments available, in addition to having a different way to register for the appointment and have DC Health notify you when it's your turn. Equity will continue to be a priority, and the DC Health will continue to set aside appointments for residents living in priority zip codes. So let me now turn to Ms. Parker, who will talk a little bit about what DC residents can expect with a different registration system.
Well, thank you, Mayor. And yes, we've been working in coordination with DC Health for almost a year on a number of different technical solutions. And one of the solutions that we've worked closely with, especially over this past week, has been the vaccination appointment scheduling system. Going forward, we are looking to introduce a pre-registration solution. You'll see the first slide that we're showing you. It looks very similar to what you see today when you go to vaccinate.dc.gov and you go to the portal. We're not trying to change the process all that much. We want people to become familiar with what they need to do. And so as you go forward and you click the button, you take the questionnaire, you're going to see some of the same questions that you've already seen in the portal today, including, are you a district resident? Do you work in the district? And then what work setting you work in. You actually have to list more information about whether or not you have severe reaction to a vaccine before, and whether you're under isolation or quarantine for COVID at this moment. And all of these questions you can actually see already on the portal that exists today, vaccinate.dc.gov, where there's actually a how-to guide to make sure that you're collecting all of this information even prior to getting to a point where you need to enter it into the pre-registration system. The next part of the pre-registration system is simply more information about your address. Next is any severe reaction to a vaccine, further resident information, name, middle name, last name, and then you're done. And you've pre-registered. At that point, you'll see a confirmation slide on the next, on slide 11, sorry. And once you do that, you'll then receive an email with more information about the fact that you've registered, including a link to learn a little bit more information about preventing the spread of COVID. After that, you'll wait until DC Health makes the determination that you're a part of a group that will be asked and invited for an appointment, a vaccination appointment. We are working on making sure that we have accessibility built into the solution. So whether or not you'll get an email, phone, or text, you'll be able to determine that in your pre-registration answers. Once you receive that email, that invitation, or the email or the phone call or the text, the invitation to make your appointment, you'll see some similar slides that you'll see some similar interaction that you've seen before. First of all, you just have to confirm. Once you click on the link from that email or that text message, you have to confirm your date of birth. And then you'll be moved over into the similar mapping tool that you've seen before. You're able to select the location. We also have a new enhancement on the site that allows you to see the actual vaccine type at each site. And once you do that, you select your location. You'll get to the next slide where you'll be able to select your actual appointment, the timing of your appointment, and you're done. You'll get a confirmation page that gives you a little bit more information about where to go. And this will also be available via the call center. Mayor, I think that's it.
Okay. Well, thank you for that, Lindsay. I'm sure there'll be questions. So we'll move along. And we also wanted to mention that DC Health will be supporting what we call high-capacity vaccination sites. And so DC Health is working with community partners to open or expand 3 vaccination sites that will serve as a high capacity location where the Johnson & Johnson 1-dose vaccines will be administered. So these sites are not walk-up sites. You need an appointment, and you must book that appointment through vaccinate.dc.gov. And those locations will be at Walter Washington Convention Center, Providence Health System, and the Entertainment and Sports Arena. And Dr. Nesbitt, can you just mention how they will, who's helping us with those?
Sure. So as the mayor has mentioned, we have 3 different levels of throughput sites in our site planning for vaccinations. The lower throughput sites are 100 to 500, medium is 600 to 700. And then our high capacity sites have typically been 800 to 100, but some of them have the ability to flex up even higher than that. And so the Providence Health System and the Entertainment and Sports Arena have been open as vaccination sites that you can either book directly through them as a healthcare provider or through vaccinate.dc.gov. But because those sites have additional capacity, and also, as the mayor mentioned, we're receiving more vaccine, you'll see more appointments available at those sites to move them into high throughput status. We've also opted this week to open the convention center. It has been a high throughput site that we have identified and mapped out for that purpose, but have not had significant enough volume of vaccine to justify or to need to open that location at this point. So GW, Medical Faculty Associates, will be our healthcare partner at the convention center, and the Georgetown University will be the partner for our high throughput days at Entertainment and Sports Arena. One Medical also provides services at ESA during the week. Thank you, Mayor.
Thank you. We also want to highlight that the Children's National Hospital is serving 16 and 17-year-olds with qualifying medical conditions. And you may also register for vaccination at Children's National if you're not an existing patient. And you can link to the children's page at coronavirus.dc.gov/vaccine. We also want to clarify that all teachers and staff who work for a school or child care facility in DC are eligible for the vaccine and encouraged to use the district's pre-registration system beginning next week. We, of course, have already offered the vaccine as a priority to DC teachers and child care workers who are working in person. And beginning next week, others who are not may sign up in the pre-registration system. We also have some updates on special initiatives. The upcoming, we've talked here about our Faith and Vaccine initiative and the New Samaritan Baptist Church in Ward 5, Allen Chapel AME in Ward 8, and the Temple of Praise also in Ward 8 are reaching out to their neighbors and parishioners to participate in upcoming vaccine events. To date, more than 550 residents have been vaccinated during the 5 clinics that have occurred at the Pennsylvania Avenue Baptist Church and the New Samaritan Baptist Church in Ward 5. And they also follow the district's eligibility criteria. Senior Vaccine Buddies, which we've talked to you about as well, where DC employees, and it looks like I'm looking at those folks. Those look like our MOKers, and I think the MOKers have encouraged some other agencies, outreach teams to also be a part of the Senior Vaccine Buddy. Is that right? Okay. If it's not right, it should be right. So we want all of our outreach teams to be engaged in the Senior Vaccine Buddy program, where they are going door to door and making sure seniors are know all the vaccine appointment processes and how they can be signed up. In fact, they can be signed up on the spot. So we want to thank our senior vaccine buddies. Another program that DC Health is very pleased with, I think I can say that, is our DC Housing Authority Senior Housing Vaccination Initiative, and this is a partnership with Sibley. And over 1,000 people have been vaccinated at 11 out of 12 DC Housing Authority sites where there is a significant senior population. 450 have been fully vaccinated, and there's been a 97% completion for 2 doses. 55% of the sites are in priority zip codes, and 91% of the participants are African American. So this has been a very successful outreach partnership to senior communities. As more people get vaccinated, we know that we should expect to see some changes and adjustments in our health guidance. And this week, DC Health issued 4 new guidances, one related to travel. First steps for non-healthcare employers when employees test positive for COVID, guidance for close contacts of a person confirmed to have COVID-19, and guidance for quarantine after COVID exposure. So Dr. Nesbitt, of course, can answer any questions you have, and you can read these in full at our guidance section on coronavirus.dc.gov/phase 2. And let me just say something about one of the guidance documents related to travel. And actually, I'll turn to Dr. Nesbitt to talk about that a little bit more.
There has been some additional guidance from the CDC around the need to quarantine after a person has been fully vaccinated. And our guidance documents explains in detail what it means to be fully vaccinated because it's not the day you get the dose. So that's important to note. The recommendation is that individuals who have been fully vaccinated, if they have a COVID-19 exposure within the first 90 days of being fully vaccinated, they would not need to quarantine unless they begin to develop symptoms, of course. And then they would need to isolate immediately, be tested, and receive further guidance from their healthcare provider in DC Health. Because of the change in the policy around individuals who are fully vaccinated not needing to quarantine for the 90 days after they are fully vaccinated, it was important to us to ensure that we were not only providing this guidance to healthcare providers, our public health team that does contact tracing and engages with the public, but also to have it reflected in our travel guidance. The goal of the travel guidance is to decrease the likelihood that individuals who have exposure and may convert or seroconvert to COVID-19 become positive after that testing prior to arriving in the district, even if they were asymptomatic, we could catch those cases and reduce the risk of spread. If a person who is fully vaccinated is believed to be at reduced risk for transmitting the virus to other people for 90 days after they are fully vaccinated, we are comfortable with reflecting that in our travel-related quarantine guidance. So we still have travel guidance. People still need to be tested before they come to the district, especially those who are not vaccinated. But any individual who is fully vaccinated will have some exemptions to the travel guidance policy.
Thank you, Dr. Nesbitt. Let me say a couple of words about high school sports. We've already mentioned that we have a tentative plan to resume high school sports in phases beginning March 15th. And we emphasize tentative because we continue to monitor the impact of the spread of variants and how that might affect our experience with COVID. So let me just be perfectly candid that we hope on March 15th that this plan moves forward, and it would be paused. It would not be able to move forward if we saw any significant changes in our metrics. So let me put that out there. But it has been made very clear to us from schools and parents that they want some planning time. and we're being as helpful as we can with that. The expectation is that sports will resume in phases with the lowest contact or no contact activities beginning first, and proceed accordingly and safely. So let me move on to say, unrelated to vaccines, we just want to remind everybody that if you see something unusual, to say something. After the violent insurrection on January 6th, we remain at a heightened level of vigilance and preparedness. And so I just wanted to ask Dr. Rodriguez to say a bit more about the city's security posture.
Thank you, Mayor. As the Mayor mentioned, one of the most important programs that we have in keeping our city safe is the See Something, Say Something campaign. So we want to make sure that residents and businesses make sure that they do perpetuate that message. They know how to report suspicious activities. And it is important to note that this is suspicious activity, not the way someone looks, not the way someone dresses, but behaviors that are reasonably indicative of violence or terrorism. And so here on this slide, we have how to contact MPD and how to report that suspicious activity. Thank you, Mayor.
Thank you. And finally, happy Women's History Month. We, of course, have many brilliant women here in D.C., and I want to thank all of them for advancing the causes of equality that we continue to fight for in our country, including making sure that workplaces honor the hard work of women, promote women because of their merit, and ensure that they have safe workplaces. And I'm proud that DC government is one of those places. I want to acknowledge two outstanding women who are with me today, who have been leaders in making sure the district can respond to COVID-19, Dr. LaQuandra Nesbitt and our CTO Parker. So thank you for your hard work. So with that, we'll take questions. Yes, Mark. Good morning.
Good afternoon.
Good afternoon.
First, I think I speak for all of us when I express
Thank
our
you.
condolences to you and your family.
Thank you, Mark.
Could somebody talk a little bit more about the pre-registration process, and will you, starting next week, continue to alert when different phases are, as you have been, like when new groups become eligible, and what people should do if they don't pre-register? Can they still then go in when they see that their group is available? How will things change going forward with pre-registration?
Sure. Let me ask Dr. Nesbitt to talk about that.
Sure. So thank you, Mark, for the question and opportunity to clarify or add additional context. I think, I'm extremely appreciative of the support and leadership we've had from Director Lindsay Parker over the last several months, including helping to set up our testing infrastructure that I know many people use on a daily basis, and then extending that capacity to our vaccination infrastructure. We will always provide information in terms of our moving to a next phase or a next tier of a phase. So right now we're in phase 1C, tier 1, only activating the 18 to 64-year-olds with qualifying conditions. When we get to a point where we're able to add more essential workers or getting ready to move to the general public, we will notify individuals of that. It's important to note that the pre-registration system is not a one-time event. So when the system goes live next week, people will have, until we're done vaccinating or transitioning this initiative to the private sector, the opportunity to go in and pre-register at any time. The online portal will be available 24/7, 365, barring any need to make updates related to maintenance or anything where the system would have to go offline temporarily, and we would notify the public of that. The call center's hours of operation will remain as they are. They're typically 9 to 7, Monday through Friday, and then we have some weekend hours that are a little bit shorter, still 9 to 4-ish. So that time, anyone can call in and pre-register for a vaccine appointment. Underscoring all of this is that the process and the cadence by which we receive vaccines from the federal government, which is how we make appointments available, is unchanged. So we still can only make appointments available as we know we will have vaccine available to support those appointments. Right now, we get notifications once a week of how much vaccine is available to the district by all 3 vaccine types. So the Moderna, Pfizer, and the Johnson & Johnson product. When we have that type of information, then we know what types of appointments to make available. As the mayor also mentioned, equity will be a priority for us throughout this process. Right now, we have a day, Thursdays, where only priority zip codes that have had the highest burden of disease are able to access appointments, and then the portal opens citywide the following day. As we release appointments to the public, we will continue to follow that same balance, right? We will continue to allocate appointment opportunities to those individuals who have the highest burden of disease in our community at a higher rate than individuals who have a lower risk due to the communities in which they live and other indicators that we've seen. So that's kind of how you can expect that process to work long term. So our ability to pulse out or to send out vaccination appointments is largely a factor of how many doses of vaccine we have in from the federal government, as well as the response times to individuals. So we can highlight here that booking through the portal is one option of many that exist. It's the larger option for people to come in and access the most appointments at any given time, and that number will continue to increase. However, your healthcare provider has vaccines for you. If you would go and receive care at any of the healthcare facilities, the hospitals or health systems in the district, any of the federally qualified health centers in the district, they all have vaccines, and our dialysis centers have vaccines. So there's other opportunities for people to access appointments, and their vaccination appointments are not all exclusively booked through the vaccinate.dc.gov portal. So those are we know that people may get vaccinated somewhere else after pre-registration, and that will impact our ability to send out more appointments to the next group of people after folks decline.
When will people be able, is there a date certain when people can begin to register, pre-register?
Our goal is to have it in place next week, where we would not necessarily have the need to push out appointments in the same process that we did today.
Yes, Amanda.
Thank you. And yes, I just want to reiterate my condolences to you and your family, Ms. Mayor. My question has to do with just a follow on Mark's question. When you say you're prioritizing residents who carry the highest burden of disease, can you further clarify, like, is DC Health looking, when they begin sending opportunities, notifications, are you starting with seniors first? Are you starting with?
So I'll give you an example. So I'm clarifying that this is an example because I know sometimes it's the posture here to say on date such and such, you said exactly this would happen. And we have requested repeatedly the opportunity to have a flexible program that is adaptive to the needs of our population. So we have rolled out the vaccine in terms of priority eligibility based on the individuals with the highest risk for disease, severe disease, hospitalization, and death. That's what we call our morbidity and mortality group. So starting with people who lived in long-term care, right? And then we also have another group, another parallel arm around preserving societal function. So essential workers that we wanted to ensure that we could protect very early on so that the services that they provide that cannot be disrupted will continue to go on. So healthcare workers, for example, were in phase 1A. So when I say something like the highest burden of disease, I'm also referring to the zip codes that we have prioritized to ensure that where the most COVID-19 disease has happened in the district, that they have the individual to access vaccines, right? That they're not being moved out of the system, that we are balancing their access and creating access specifically for them. We've done it by ensuring that the majority of our vaccination sites are in the communities that have the highest burden of disease, and we need to continue that process through the appointment scheduling system. It's not effective to only locate the clinic in a community that has a high burden of disease. You have to actually facilitate the process of them accessing an appointment. So what this could look like is half of the appointments we give could go to those priority zip codes and the other half would go citywide. And then within that rubric, we may also make some changes in that 50% and 50% to say, okay, now we're making fewer seniors are signed up or fewer seniors still need left to be vaccinated, so I don't have to account so many for that phase. I may be able to give more vaccines to people who are in the qualifying conditions where risk is lower than being over 65. So hopefully that gives you some context in terms of what we're thinking.
So you're right, so what I'm hearing you say is you're looking at zip code, age, medical history, I mean, the things that you...
Correct.
Yeah.
The phases by themselves,
Yeah.
right, are a indicator of what your risk for severe disease and illness are if you get COVID-19. So individuals in long-term care facilities we're taking care of through a special initiative. Then we move to people over 65, and then individuals 18 to 64 with qualifying medical conditions. So you can appreciate, I hope, that our priority would still be to get our seniors vaccinated and to then get individuals 18 to 64 vaccinated with qualifying medical conditions. So seniors are likely going to be highly favored in our system for getting access to appointments because their risk for severe disease, illness, hospitalization, death is higher than the general public, okay? And it's higher than individuals in groups 18 to 64 with a qualifying medical condition. The second part to that I want you to understand is that geography matters to us in the District of Columbia. And we've been ensuring that residents who live in certain priority zip codes will get access to appointments. We're going to hold to that commitment when we go through our process.
And how is data registering factoring? And also I wanted to ask, are you encouraging everyone to pre-register next week? Can it handle the demand?
Can you repeat your first question?
Absolutely. How does date of registration factor into this?
Okay. So chronology is our least favorite, is the thing that we will wait the least, right? So just because you go into the system the first day that it opens doesn't mean you're going to be the first person to get a vaccine appointment. It has to do, again, with those priorities that I've just listed to you. Over 65, 18 to 64, living in a priority zip code, and then we look at the essential workers after that. We would be hopeful that people are not going to just go into the system who are members of the general public, not meeting any of our current criteria, to pre-register, believing that they're creating a place for themselves in line, or that they will be vaccinated in the next week or the next 2 weeks. So these are the expectations we need to manage. When people try to think of this as a wait list, then they assume that I'm number 17 on the list, so as soon as there are 30 doses, I'm automatically vaccinated. That is not the process that we're putting in place here.
I'm just going to go down the line if you don't mind. Perry?
Yeah, just a quick follow-up to her, and then I have a question about teacher vaccinations. But when you say seniors are highly favored, does that mean every senior who registers would get an email before every 30-year-old with a health condition? Or is there some ratio, some percentage of appointments? Are you guys...
Not necessarily to either of those.
Okay. So are you guys, how are you sorting this? Is it through, this is a technical question, but is it...
It is a very technical question. I mean, how much technical stuff do you want to know? But we manage and analyze data frequently at Octo, at DC Health, at a number of agencies to be able to see who's in the system, who's registered, et cetera. Again, seniors, the mayor just mentioned to you a number of initiatives we have for vaccinating seniors, right? We do the housing, our housing partnership. We set aside vaccine appointments to the senior vaccine buddies, et cetera. Because those initiatives are so rich and they're getting more and more traction every day, a senior may not decide to go into the portal. And then there may be a senior who goes into a portal who lives in outside of the priority zip codes. So people in priority zip codes that are 18 to 64 may get an appointment over a senior who does not necessarily live in a priority zip code because of how we may be balancing the allocation of appointments in order to increase vaccination coverage in those zip codes or geographic areas that have had the highest burden of disease.
But that's what we're doing now.
Correct.
It's just that we're doing it every week, and when the appointments are out, we'll do it again the following week. The difference is that we're going to look at that stratification with a pool of people who've raised their hand and said, I want to be registered to be vaccinated. But if you understand, as I know you do, how we make available appointments right now, you'll understand how the registration system works.
And thank you very much. Can you explain teachers? I know you now have, today you announced that more teachers would be eligible for the vaccine. How is that prioritized? Are they just part of this big group that's qualified, or is it a separate kind of wait as we look? I know you mentioned essential workers. But yeah, can you explain how teachers and when they can expect to get the vaccine, assuming, you know, if they're...
People can expect to get the vaccine when they get a notification email from us.
But before you answer that, because I don't want anybody to think that DC teachers haven't been vaccinated. We have vaccinated, is it I'm not remembering the number.
Well over 3,000.
Over 3,000, and that doesn't include the child care workers. And teachers were prioritized in our distribution system starting January the 25th. There are teachers who are working at home and will work at home for the rest of the year. But we have also, and then there are others who are working at home now who will come in. So there's many groups of teachers, and we actually think the group of teachers who remains to be vaccinated is not that large. So those teachers will, as I said earlier, be able to register with the new system.
Because I guess my point, I realize I think something like more than 90% of people in school buildings, anyone who wanted it has had the vaccine who are in school buildings now, and now looking to term 4, a lot of, I've heard some principals tell their families that, you know, they see as teachers getting vaccinated, the ones who are still virtual, key to getting them to volunteer or to come back. And I know you have said that is, you know, reopening is not contingent on vaccines, but I am curious if you think these teachers stand a chance with this system to get fully vaccinated before 4th term starts.
We won't put any condition on when we determine that our school demand needs more adults in the building, as you know. Yes.
Thanks. Thank you, Mayor. And again, let me share my condolences.
Thank you.
Your loss. So it sounds like today went a lot better than the 3 days last week with people being able to get their vaccine appointments. But with the new site coming next week, are you doing user testing with people who, especially with the people who live in those high-risk areas, those high-risk zip codes? And is testing being done to make sure that the new site doesn't crash under what, you know, presumably will be a very heavy interest?
Let me turn to Lindsay to talk about preparations.
Yep, thanks for that question. Last week on Thursday, we saw almost a 27,000% increase in traffic to the site, in attempts on the site. And it was sort of obviously unprecedented. We'd seen like 62 concurrent users at a peak in the past. Last week, we saw 8,780 all trying to do one thing at the same time. The next day, 20,000 all trying to do one thing at the same time in 5 minutes, right, of time. And so caught the Microsoft platform a little off guard, and I apologize for that. We've made a number of improvements over the past week to make sure that today went very well. We had enough server space, enough capacity, enough availability, and we've done a number of load tests over the past week to make sure that we were ready for today. This is going to be the same platform that will sort of support the pre-registration system, but the interesting thing that I'm excited about the pre-registration system because it's going to flatten some traffic out for us. So we won't see sort of these like massive rushes to the site every other week or every week, and as a result, we can better prepare and make sure that what happened last week will never happen again.
But are you doing that live user testing?
Yeah, actually, we have actually set up a sandbox to allow for that to happen, and have a number of different community members that have reached out and actually made themselves available to do just that. So we will be doing that.
And in terms of you know, when issues arise, I think, you know, certainly, you know, last week we had instances of council members, I think, trying to offer troubleshooting tips about multiple browsers, multiple devices, clearing cache, you know, clearing caches, which you know, some maybe, you know, not everybody is so tech savvy. What's being done, you know, in the event that there are issues with the new site to make sure that people have a fallback or know that things are being addressed?
Well, I would start by saying over the past few days, we've taken a look at every single error message that you could possibly receive on the site and really thought about the wording to make sure it's super accessible to anybody that's using the application. And as a result, I think today, I tried it. I think a few people in this room tried it. A number of people online got a lot of tweets and texts, as you can imagine, and I think some of those helped make sure that people understood exactly where they were in the process, and we'll just continue to get better at that.
Yes.
And where I as well express my condolences for you and your family.
Thank you.
I guess I'm wondering why DC was taken by surprise by the influx in traffic. I mean, I realize that's a huge jump in people, but this new phase also is a huge jump in who's available to get it. I think I've seen estimations of maybe 100,000 individuals. So why was DC unprepared for that demand?
I don't think anybody was surprised that there would be increased demand. The system didn't work the way it should have. That's just, it didn't work. It didn't.
Okay. There are ways to, like you said, to load test and to prep the system for this. So was there load testing done in advance? Was there preparation for that influx that just didn't work?
You have another question? I told you it didn't work. I don't really have anything else to add to it.
So again, since there are so many people eligible for the vaccine now, I'm wondering if you have kind of a rough estimation of when we'll start to move into the next phase, and especially when food service workers and restaurant workers will become eligible for vaccination.
We don't have an exact date for that, or even a tentative date that we would pose. We are, like many jurisdictions, very optimistic by the actions of the Biden administration that will make enough doses available for every adult in the U.S. by the end of May. Now, what that means in terms of how many doses we actually get in the district that supports our need to vaccinate D.C. residents and essential workers who work in the district, regardless of their home jurisdiction, whether they live in Maryland, D.C., or Virginia, how quickly we can move through particular phases is still contingent upon our own direct state allocation and the demand for the vaccine by already eligible groups. So I think we've covered very extensively that the demand is still high for 18 to 64-year-olds with qualifying medical conditions. As you have noted and is accurate, it is the largest single group that we have ever made eligible for vaccinations at a single time. So there could be a while, or it could be short. If we get 100,000 vaccines next week from the federal government, it picks up the pace. If we continue to get 17,000, 20,000, it keeps us at our current pace.
Yes, Mark.
Two questions about staying on COVID. One, either the mayor or Director Nesbitt, what do you say to Nationals fans, particularly who are upset about the possibility that no fans would be allowed come opening day, specifically to their concerns where they say, why is it safe to go inside to church, inside for a restaurant, inside for school, but not safe to go outside to a baseball game in some limited capacity?
Well, I would say to them to be patient, and we will continue to work with the team and give the best advice and guidance that we can.
From a public health perspective, Mark, I think you've heard us state on a number of occasions, even as we've been rolling out vaccinations, that the need to continue to wear your mask, to wash your hands, to keep your distance, and to avoid large crowds is still very real. So this notion that mass gatherings, whether indoor or outdoor, are all of a sudden appropriate, we need to make sure we're distinguishing between what happens in a small indoor space with a small number of people, such as the education environment, versus a mass gathering, whether it be indoor or outdoor. That still carries a significant risk for the individual and for the public health and health system.
And then Dr. Nesbitt, can I ask you about your visit with Vice President Harris? Can you tell us if you just now complained about the wanting more doses from the federal government? Have you gotten a written answer to the FEMA letter about federal doses being allocation for federal employees? And what did you say, if anything, to the Vice President about increasing the allotments and the inequity that you see here in the district?
Well, I'll let Director Rodriguez speak to the FEMA request. But as you attended the event, I think you heard a number of us on a number of occasions talk about the need to have more vaccine available to meet demand. That is not a comment that goes unsaid to the Biden administration from the District of Columbia. We're very clear on our need to have more vaccines. We believe that more people in communities of color, more of them would be vaccinated if we had more vaccine. It's not just about identifying the place to give the doses. It's not just about changing the scope of practice for healthcare providers as ways of creating access. If you don't actually have the product, you can't get shots in arms. I think I'm okay. I think I've clarified for you that in the context of our full discussion that we had, we talked about vaccine access broadly.
Amanda? Oh, I'm sorry, letter.
So, Mark, the way that we request federal resources is through a system where we put in a resource request form. It's called an RRF to FEMA. That request form has come back to us as not approved.
Amanda?
Oh, yes, thank you. I guess a follow on that is how does that impact your planning? And what was our total shipment this week? I may have
No, it wasn't in here.
It wasn't in here.
I didn't mention it.
We received the same number of Moderna and Pfizer vaccines, which I think is around 17,000.
As far as the Johnson & Johnson, I wonder if how you're thinking about this because it's a one-shot dose. And I don't know if there are ideas about more mobile sites, if you would ever consider a walk-up site. How are you thinking about it just because it's so different from the Pfizer? Yeah.
The easiest question you've asked me is whether or not we're going to offer a walk-up site for a large number of people. And our immediate reaction to that is no. Things need to be done decently, in order, and it is very frustrating for people to come and stand on queue for hours. We know this from H1N1, and to be told that we are now out of vaccine. So scheduling in advance, whether you're scheduling in a place where 30 people are going to be vaccinated that day or 3,000 people are going to be vaccinated that day, is a better customer experience and is what the public wants. Now, Johnson & Johnson does have some differences in terms of its storage and handling requirements, as well as it being a single dose. We've heard from people in our just daily conversations, and anecdotally, we haven't officially collected any data for this, but there are some people who want just one dose. They only want to get a shot one time, and they have various reasons for that. Either their own approaches and feelings about healthcare or the convenience of a single dose shot. So we expect that demand for Johnson & Johnson will be there across the city. We had as Director Parker displayed on the screenshots, where the dose that is available, or the type of vaccine that is available as a parent, that actually happened today as well. And all of our appointments were claimed. So people know they're going to a place that has Johnson & Johnson, they know they're going to a place that has Moderna, they know they're going to a place that has Pfizer. The storage and handling requirements may offer us some more flexibility around doing more mobile type initiatives. We probably may be thinking about mobile differently. I'm not thinking about mobile as in driving a van around a community. Mobile for us is like a one-day site somewhere. That does create the opportunity for us to do that, because community-based organizations who want to host those types of events won't necessarily have to have the freezers and all of those things. The vial still has to be used within 6 hours of it being punctured, so managing and knowing ahead of time how many people are going to be there is extremely important. But do note that we did discover and work effectively through ways to move the Moderna and Pfizer products into community as well. And we've done that by vaccinating seniors in 11 DC Housing Authority properties, and we've done that through the Faith and Vaccine program that happens as a one-day event on the campus of a place of worship. So it is possible to move these vaccines around. It takes a lot of logistics and early planning, and that may diminish with the Johnson & Johnson product.
Thank you. Sorry, just two more questions about reopening. You mentioned that there was this, right, the dial today was high school sports. I wonder what other things are on the table and you're considering as cases have gone down from our holiday surge. And then a second question would be, would the timing of increasing restaurant capacity indoors coincide with vaccinating those, or at least opening up eligibility for those workers?
I don't think so, but I don't think that's not something that we've determined. And we have, and I'm not sure if it's been mentioned already, but DC Health expects to make some recommendations to me around our experience in the middle of this month. Some things that need a lead-up time, we're trying to give those industries or sectors some lead-up time to think about that. You heard from us today about high school sports. You've also heard this week about travel. And so, knock on wood, that things go well. I think that we can expect middle month to have some things loosened up. And I'm not trying to be coy with you, but I don't have anything more to add to it right now. Okay, and then I'm going to do these two, and then I come back. And Mark, you'll have the last one. Okay, Perry.
I think this is for Dr. Nesbitt. You have Fairfax and Montgomery County, which are reopening their schools, starting to reopen this month, and they have very different protocols in DC. Most specifically, their cohorting rules are less strict, so you have kids being able to move classes between middle and high schools. Private schools in the city are also doing this. Many families like this, some don't. My question for you is, I've talked to, DC Health said they're reviewing these guidelines. Can you talk to me specifically about what you're reviewing and what factors you're considering? Is there a possibility the health guidelines for schools change this academic year?
So, Perry, we review all of our guidelines on an ongoing process, and so you will get that comment from us very often. Because as the science has changed, as we learn more information about the virus, and as we get more information from case studies and morbidity and mortality and weekly reports that are published from the CDC, it can help shape our thinking where we have made some decisions because we still needed to learn more that now we have a little bit more information about. For example, you all have seen studies that have shown that where the transmission of COVID from student to student has occurred, most of it happens with students who are engaged in sports. Which we knew, and now there's published information around it, which is why we've made the decision we've made around school sports and athletics. You also have been able to see case studies of places like Georgia that did not social distance and did not require masks, had outbreaks in a number of schools in their districts. So hopefully you've taken an opportunity to review that to understand why we make the decisions that we make. And you've also seen that when places keep children 6 feet apart, where there is a limitation of floating for teachers and where children don't mix outside of their cohort, which is when you talk about a traditional high school day, you cannot establish a cohort that way. So our recommendations are very consistent with what the evidence has shown and what the CDC's recommendations for school are. And we will continue to evaluate with our education partners where they see that they are able to have operational things that fit into our requirements. We'll continue to give them guidance and advice about that.
And I know private schools that I've spoken to have been doing this mixing of cohorts in DC since October. I'm curious what you have seen from those high schools and middle
Which
schools
high
doing
schools?
that.
Which high schools?
I know St. Albans is doing
Okay.
it, Washington International is doing it. My understanding is that most with upper schools, in the independent schools.
For high schoolers?
High school and middle schoolers,
Okay.
yeah.
I mean, I think that we, as you know, we did a kind of a quick review of the independent schools early on. I think probably September, October. It may be time for us to do another review to get their best practices and what they're finding. I think there's some other things that they've done too around testing, simulcasting their lessons. So you have some teachers in and still have groups out. So we are certainly happy to learn from best practices, but we'll also want to know what their spread is. They don't report like we report information about cases and spread. So while I will want to hear about that, I also want to hear about cases and spread.
Does DC Health know about spread within or what you have seen in private schools?
We've published our outbreak data.
But that's lumped with daycares too, right?
I'd have to look at it, but I don't believe that it is. I believe schools are separate from child care facilities.
Okay, yes.
So as vaccines have accelerated and some more things have opened up, a number of other states, I think including New York, have started testing out vaccine passport apps where people can maybe show on their phone that they've been vaccinated or at least tested negative recently. Are you considering anything similar to that, of that sort in DC?
We haven't at this stage, but let's just be clear. We want people to get vaccinated, and the way to get to more normalcy is for people to get vaccinated when it's their turn, and we think that's hugely important. So one thing that we talked about today is how people who have vaccines can travel differently and quarantine differently. And I don't know what type of continued advice and guidance we'll get from the CDC around this, but it's better to be vaccinated than not to be vaccinated for us to get back to a normal way of life. We haven't. Yes, ma'am.
Yes, Capitol Police apparently have requested that National Guard remain at the Capitol for at least another 60 days. I know previously you've said there would have to be some kind of viable security alternative for the current measures to come down. I'm wondering if you have any better idea of what those alternative measures might look like and when they might come to place. We've seen reports saying that fence might be up as late as September. Is that your understanding?
That is not my understanding, especially in its current formation. And I think they've already made some adjustments to it. I had an opportunity to talk to I'm not sure what they're calling that committee, but the initiative that General Honore is leading, the chief, Director Rodriguez, have all had a chance to talk to them about our perspective. And so I think they will have an interim report that they will advise Capitol leadership on, and we expect to continue to be involved in those discussions. I also made clear that we wanted them to look to MPD as an additional resource. There's none of our police departments in the region should think about how to go it alone. That's why we have mutual assistance agreements. So I think it's important that in any permanent update to the Capitol Security Plan that they're thinking of it in that way. Did I answer your question? Did you have something else in the... It was our expectation that the additional forces would be leaving like now. And so the Director Rodriguez briefed me on this request. And so the Capitol Police have had very little, how should I say? Public interaction. So we get this message that they will, okay, so there could be a reason that I'm not aware of. Now, let me be clear. Capitol Police is talking to MPD, and we're talking to this one, and we're talking to that one. But we don't know why additional forces have been requested until May. That's the most plain I can answer you. We don't know why. It was our expectation that the National Guard support would be lessened significantly around this time. I see adjustments to the fence, imminent. I thought they had already started to make some adjustments to the fence line. I don't know what they're going to do about the immediate perimeter around the Capitol. Yes, sir.
Mayor Bowser, if I could just, it's been about 1 year since your
Yes.
first COVID-19 press conference. And I'm just wondering if you can reflect on that. A lot has obviously happened and, we're not through yet, but looking back 1 year that you've been giving at first daily press briefings and then bi-weekly press briefings, can you just reflect for us on 1 year later?
Well, Mark, it has been incredible, and I don't think any one of us, including you, would have expected that we would have to shut down our city, close schools, send people home from work, modify our thriving hospitality, arts, and entertainment, have our hospital and healthcare workers fighting a deadly virus, at first with limited supplies, and to lost over 1,000 Washingtonians. So no, I don't think that any of us expected it. I have to say how proud I am of my team. And how proud I am of DC residents. You may remember when we all met together at the Armory. And it was Sam, actually, who looked at our model and thought it was the most ridiculous thing that he had seen. Surely 1,000, because then we thought that we would hit 1,000 fatalities in November. And all of us thought, we thought he was kind of right, that probably wasn't going to happen to us. That, that many people, I think the model said 24,000 people would get COVID and 1,000 people would die by November. And it turns out, and even me, I got to tell you, I thought it was going to be over by the summer. I didn't think that we would go into a fall and a deadly winter. But we did. This virus has been, it's been hard. It's been, and dealing with something and fighting something for a year is also hard. So having said all of that, DC residents blunted the curve. They did by their actions. They sacrificed a lot, but it allowed our hospitals and our hospital workers to be able to have what they need to support people, and to save lives. And that is, when we started that press conference, that was our charge. How do we blunt this curve so our hospitals can be prepared for people who get sick? And then how can we stop so many people from getting sick? And now it is our charge to crush it where it's in sight, right? So don't give up yet, because it's in sight. And how do we crush it so that we can get back to normal, get people vaccinated, go back to school, go back to work, and get our wonderful, thriving city back. And we're optimistic about it. So that's the human toll. The economic toll is a whole nother story. We've had many people who haven't been that affected economically, quite frankly. Some are even better off. And then others have been wiped out. Their businesses, their savings, their hope about what's coming next. And everything that we do in our recovery has to be, how do we support them in this period of relief? And then how do we come back even stronger, and build those jobs back and allow those people to get back to normal too. So it's not over yet. As bad as it's been because of people's sacrifice, it wasn't as bad as it could have been. And it's not over yet. So that's my general assessment. Not that eloquent, but true. And just everybody, if you continue to follow Dr. Nesbitt's advice, we'll get to the other side of it. And the last thing I'll say, even in the last several months, that we just see that the commitment from the administration to produce those vaccines. Just a few weeks ago, we thought that every adult would have enough, we would have enough vaccine for every adult by July. And now that number is May. That time frame is May. That's two whole months where we can have most of our adults vaccinated. That changes a lot about how we can recover from this virus. So I pray that is the truth. And more than that all of these systems and technologies that we're asking to do things that we never thought, from scheduling tests to vaccines to delivering unemployment, we're making all of those things work as best that we can to get people back. But I want to thank all of you guys too for, I'm sure, doing your jobs in the ways that you didn't think you would be asked to do either. So thank you.
We now return to our previously scheduled program, already in progress.